I'm about to share something that may truly shock you, something that could be sitting in your medicine cabinet right now, quietly damaging the most important organ in your body. I'm Dr. Maria Lee, and after more than 20 years as a cardiologist working primarily with older adults, I've watched sharp, mentally clear patients slowly slide into confusion and memory loss. Not from Alzheimer's disease, not from stroke, but from a medication they trusted completely. This is not a rare drug. It's prescribed millions of times every year. There's a good chance your doctor has written this prescription for you. Pharmaceutical companies have no interest in highlighting this risk. And many doctors don't warn patients, not out of malice, but because they simply don't recognize the connection. I've seen it again and again. Patient after patient. Brain after brain. And I can no longer stay silent. By the end of this video, you'll understand which commonly prescribed medication is associated with up to a 50% increase in dementia risk, why it becomes especially dangerous after age 60, and most importantly, what you can do starting today to protect your brain. But before I tell you what this pill is, you need to understand 5 ways it damages the brain. 5 mechanisms that make this medication one of the most dangerous drugs a senior can take long-term. And mechanism number 5, the one I'm saving for last, is so severe that it can cause permanent brain damage that looks indistinguishable from Alzheimer's disease. This is not fear-based messaging. This is information that can preserve your independence, your memory, and your quality of life. Stay with me, because what you're about to learn could add years of mental clarity to your future. Let's begin with mechanism number 1. This medication slows your brain activity. Not figuratively, literally. It reduces electrical signaling between neurons. That's how it works. That's why doctors prescribe it. For anxiety, it feels calming. For insomnia, it induces sleep. But here's what almost no one explains. When you artificially slow brain activity day after day, month after month, the brain adapts. Let me tell you about Eleanor. Eleanor was 73, a retired librarian. Exceptionally sharp. She read 2 books a week. Did crossword puzzles every day. Never forgot names or details. Then she began having trouble sleeping. Her doctor prescribed this medication, a very common prescription, written millions of times a year. Within 6 months, her daughter noticed subtle changes. Eleanor was repeating herself, forgetting conversations, getting confused about appointments. After a year, the changes were unmistakable. She couldn't remember what she'd read just minutes earlier. The crossword puzzles were abandoned. Familiar faces suddenly felt unfamiliar. Her family feared Alzheimer's disease. They began discussing memory care. But here's what no one realized. It wasn't Alzheimer's. It wasn't aging. It was the medication. The pill Eleanor took every night was steadily suppressing her brain's ability to function normally. That brings us to mechanism number 2, and this is where it becomes truly alarming. This medication doesn't just slow the brain temporarily. With long-term use, it permanently alters brain chemistry. Over time, the brain reduces its own production of calming neurotransmitters. It becomes dependent on the drug. This is why people can't stop taking it abruptly. Sudden withdrawal can cause severe anxiety, seizures, and in rare cases, death. But dependency is only part of the problem. Brain imaging studies show real structural changes. The hippocampus, the part of the brain responsible for memory, actually begins to shrink. Not subtly, measurably. Long-term users of this medication have hippocampi that are 15 to 20% smaller than those of non-users. Your memory center is literally shrinking while you sleep, without your awareness. Let me tell you about Richard. Richard was 71, retired engineer with a brilliant mind. After his wife passed away, anxiety overwhelmed him. His doctor prescribed this medication. It helped at first. Soon, he needed it daily, then twice a day. Within a year, he couldn't function without it. His daughter noticed memory lapses, confusion, difficulty completing tasks that once came easily. A neurologist evaluated him. The words early Alzheimer's were mentioned. But one physician noticed the prescription history and suggested something different, a slow, medically supervised taper. It took 6 months to come off safely. And something remarkable happened. Richard's cognition improved. Not completely. Some damage was permanent, but the confusion lifted. His memory partially returned. He was present again. It wasn't Alzheimer's. It was the medication. And no one had connected the dots until it was almost too late. Now we arrive at mechanism number 3, and this is where the research becomes undeniable. This medication increases the accumulation of toxic proteins in the brain, specifically beta-amyloid plaques. These are the same protein deposits that define Alzheimer's disease. In other words, this pill doesn't just mimic dementia symptoms. It accelerates the biological processes that cause Alzheimer's itself. A major long-term study published in a leading medical journal followed more than 9,000 adults over age 65 for 15 years. Those who used this medication had a 50% higher risk of developing dementia. 50%. Another large study found that using this medication for more than 3 months increased Alzheimer's risk by over 30%. At 6 months, the risk nearly doubled. And here's the most disturbing part. The risk does not disappear when the medication is stopped. The damage accumulates. The toxic proteins build up over time. Even years later, former long-term users show a persistently higher dementia risk. Every pill you take may be creating changes in your brain that cannot fully reverse. And most people are never warned. Before I explain mechanism number 4, I need to show you something that may genuinely make you angry. Because the medical community has known about this connection for years. The research has been published in respected medical journals. The evidence is clear. And yet millions of seniors are still prescribed this medication every single day as if none of this exists. Pharmaceutical companies remain silent because this drug class generates billions of dollars. Many doctors haven't connected the dots, not because they don't care, but because they're rushed, overloaded, and relying on outdated prescribing habits. But I've seen too many patients lose their memory, their independence, and ultimately themselves to stay quiet. And mechanism number 4 shows just how insidious this process really is. Mechanism number 4 is that the cognitive damage happens so slowly that you don't recognize it until it's advanced. Unlike a stroke, where damage is sudden and obvious, this medication harms the brain in slow motion. You begin forgetting small things. You brush it off as normal aging. Maybe you're tired. Maybe you're stressed. By the time the changes are obvious enough to seek help, you've often been taking the medication for months or even years. The damage has accumulated. Toxic proteins have built up. Brain structures have already begun to shrink. And the dependency is so strong that stopping suddenly is dangerous. Here's the cruelest part. By the time you realize something is wrong, the cognitive impairment itself makes it harder to advocate for yourself, harder to research alternatives, harder to question medications, even harder to remember that you should be questioning them. Let me tell you about Margaret. Margaret was 68. After retiring, she began experiencing anxiety. The loss of routine and structure felt overwhelming. Her doctor prescribed this medication. It helped. She felt calmer, more stable, but over the next year, subtle changes appeared. She would walk into a room and forget why she was there, lose her train of thought mid-sentence, tell her husband the same story multiple times without realizing it. She mentioned these changes to her doctor and was told it was normal aging. Nothing to worry about. Keep taking the medication. By 18 months, Margaret was repeating entire conversations from earlier the same day. She missed appointments even when they were written down. She became disoriented while driving familiar routes. Her husband pushed for further evaluation. An MRI showed brain atrophy. A neurologist diagnosed early dementia. They were told to prepare for progression. But her husband refused to accept that answer. He reviewed every medication she was taking. He found the research linking this drug to cognitive impairment. He brought the studies to another physician. Together, they created a careful tapering plan. It took 8 months to come off the medication safely. And slowly, Margaret improved. The mental fog lifted. Her memory partially returned. Not perfectly, some damage was permanent, but she regained her independence. She regained herself. The dementia diagnosis was wrong. This was medication-induced cognitive impairment. If her husband hadn't pushed, she would likely be in memory care today, still taking the very pill that was destroying her brain. Now, before I tell you exactly what this medication is, I need to ask something of you. If what you're hearing makes you angry, or if you're thinking about someone you love, please share this video. Think about your parents, your grandparents, your friends who take medication for sleep or anxiety. This information can literally protect their minds. And subscribe to this channel. My mission is to share information that can prevent preventable cognitive decline, information most people are never given. Now let me show you mechanism number 5. This is the most devastating mechanism of all. This medication interferes with your brain's ability to clear waste. Your brain has a built-in cleaning system called the glymphatic system. It works primarily during deep sleep, flushing out toxic proteins and metabolic waste. This is one of the main reasons quality sleep is essential for brain health. But here's the paradox. This pill is often prescribed to help you sleep, yet it disrupts the deep stages of sleep where this cleaning process works best. So while you may fall asleep faster, your brain is not properly cleansing itself. You are increasing the production of Alzheimer's-related proteins through earlier mechanisms, and now this 5th mechanism is preventing your brain from clearing them away. It's a perfect storm. Increased accumulation combined with impaired removal. Advanced imaging studies show that people taking this medication have significantly reduced glymphatic flow during sleep. Over time, this leads to measurable buildup of tau proteins and beta amyloid, the exact pathology seen in Alzheimer's disease. You are not developing Alzheimer's despite taking this medication. You're developing Alzheimer's-like brain changes because of it. Now I need to tell you what this pill is. It's a class of medications called benzodiazepines. You may recognize the names: Xanax, Ativan, Valium, Klonopin, Restoril, Halcion. They are commonly prescribed for anxiety and insomnia. Millions of prescriptions are written every year, and they work very well for the symptoms they're designed to treat. But the long-term cost can be your brain. Now hear me very clearly. If you are taking one of these medications right now, do not stop suddenly. Abrupt withdrawal from benzodiazepines can cause severe anxiety, seizures, and in rare cases, can be life-threatening. These medications must always be tapered slowly under medical supervision. But you deserve to know what you're taking. You deserve to understand the risks. And you deserve a conversation with your doctor about whether continued use is appropriate for you. Here's what the research shows. The longer benzodiazepines are used, the higher the dementia risk. Less than 3 months of use shows minimal increased risk. 3 to 6 months is associated with about a 30% increase. More than 6 months is associated with an increase approaching 80%. And long-term use over several years has been associated with more than double the risk in some studies. And benzodiazepines are not the only medications linked to cognitive decline. There is a second class of medications that is even more widely prescribed than the first. These drugs are found in allergy pills, sleep aids, bladder medications, and even some antidepressants. They are called anticholinergics. Anticholinergics block a brain chemical called acetylcholine. And acetylcholine is absolutely critical for memory, learning, and attention. It's the chemical that allows you to form new memories and retrieve old ones. Here is the devastating irony. The primary medications used to treat Alzheimer's disease, drugs like Aricept and Exelon, work by increasing acetylcholine levels in the brain. We treat Alzheimer's by boosting this chemical. Yet at the same time, we prescribe millions of seniors medications that block it. In effect, we are giving people drugs that create the same brain chemistry seen in Alzheimer's disease. Let me give you some of the names, because many of these are extremely common. Diphenhydramine, better known as Benadryl. It's also found in Tylenol PM, Advil PM, and many sleep aids. Bladder medications such as oxybutynin and toltridine, often sold under names like ditropan and Detrol. Older antidepressants like amitriptyline and doxepin. Motion sickness medications like Dramamine. Certain muscle relaxants. The list is long and growing. All of these medications block acetylcholine. All of them impair memory. And all of them are associated with increased dementia risk. A large study published in JAMA Neurology followed more than 3,400 adults for 7 years. Those who used strong anticholinergic medications had a 54% higher risk of developing dementia. People who used them for more than 3 years had an even greater risk. And here is the most frightening part. That increased risk persisted for more than 20 years after stopping the medication. 20 years. This suggests that the damage may be long-lasting and, in some cases, permanent. Let me tell you about Walter. Walter was 76. He was taking 4 medications with anticholinergic effects, plus a benzodiazepine for sleep. His cognitive decline was progressing rapidly. His family was preparing to move him into assisted living. We carefully reviewed every medication. One by one, we replaced them with safer alternatives. Slow tapers, close supervision, gradual transitions. The process took 6 months, but the result was remarkable. Walter's memory improved. The confusion lifted. His personality returned. His family got their father back. He remained in his home. He kept his independence, all because we identified and removed the medications that were harming his brain. This is what's possible when the real cause is recognized and addressed. Now let me show you how to protect yourself. First, make a complete list of every medication you take, every prescription, every over-the-counter pill, everything. Second, look up each medication using terms like anticholinergic burden or benzodiazepine risk. There are online tools that calculate your total anticholinergic score. A score of 3 or higher is considered high risk for cognitive impairment and dementia. Third, pay close attention to symptoms: memory problems, confusion, trouble concentrating, brain fog, difficulty finding words. If you're taking these medications and noticing these changes, the medication may be the cause. Fourth, schedule an appointment with your doctor specifically to discuss medications and cognitive health. Bring your full medication list. Bring printed research if needed. Ask direct questions. Are any of these medications increasing my dementia risk? Are there safer alternatives? Can we create a safe tapering plan? If your concerns are dismissed, seek another opinion. Your brain is too important to ignore. Now let's talk about alternatives. For sleep, instead of benzodiazepines or antihistamines like Benadryl, consider melatonin, magnesium, or cognitive behavioral therapy for insomnia. These approaches are far safer and often more effective long-term. For anxiety, instead of benzodiazepines, options include certain antidepressants with lower cognitive risk, buspirone, therapy, regular exercise, meditation, and breathing techniques. For bladder symptoms, newer medications such as mirabegron do not affect acetylcholine in the brain. Pelvic floor physical therapy and behavioral strategies can also be very effective. For allergies, instead of Benadryl, use newer antihistamines like loratadine, cetirizine, or fexofenadine. These do not readily enter the brain and do not impair memory. The key point is this: for almost every condition these high-SQI medications are prescribed for, there are safer alternatives. You do not have to choose between symptom relief and protecting your brain, but you do have to be informed and proactive. Here is your action plan. Step 1. Create a complete medication list. Step 2. Research each medication for dementia risk and calculate your anticholinergic burden. Step 3. Schedule a dedicated medication review with your doctor. Step 4. If you are taking benzodiazepines long-term, ask about a slow, supervised taper. Never stop abruptly, but don't stay on them indefinitely either. Step 5. Monitor your cognition closely. Memory, word finding, attention, clarity. If changes appear after starting a medication, report them immediately. Step 6. Strengthen non-drug strategies, sleep hygiene, stress reduction, physical activity, and a Mediterranean-style diet. And finally, the question everyone asks: if you've been taking these medications for years, is the damage reversible? The honest answer is, it depends. Some people experience significant improvement after stopping, like Richard, Margaret, and Walter. Others have partial recovery, and some have permanent damage. That's why awareness and early action matter so much. The longer someone stays on these medications and the higher the dose, the less likely a full recovery becomes. But here's the important truth: improvement is almost always possible. Your brain has remarkable neuroplasticity, even in your 70s and 80s. It can adapt. It can recover, at least partially. But you need to understand this clearly. Every single day you continue taking these medications is another day of potential harm. Every dose is another hit to your brain. The research consistently shows that stopping these medications reduces future dementia risk, even if some damage has already occurred. The best time to stop was before you ever started. The second best time is today. Don't wait. Don't assume it won't happen to you. The statistics are not subtle. Long-term use of these drugs dramatically increases dementia risk. Now I want to say one final thing, and this is important. The medical system has failed seniors on this issue. These medications are often prescribed reflexively, without serious consideration of long-term cognitive consequences. Doctors are focused on your anxiety today, your sleep tonight. They are rarely thinking about your brain 5 or 10 years from now. Pharmaceutical companies minimize these risks because these drug classes generate billions of dollars every year. Insurance companies approve them easily because many are inexpensive generics. In reality, no system is actively protecting your brain. That responsibility has been placed on you. Your mind is everything. It holds your memories, your personality, your independence. It allows you to recognize your family, manage your life, and experience joy. Without cognitive function, nothing else truly matters. You cannot enjoy good physical health if you don't know who you are. You cannot enjoy financial security if you can't manage your affairs. You cannot enjoy relationships if you don't recognize the people you love. Protecting your brain must be your top priority. Yes, these medications serve real purposes. Yes, they can help real symptoms. But in most cases, there are safer alternatives. You just have to be willing to ask about them, explore them, and make changes in order to protect your cognitive future. You deserve to keep your mind. You deserve to age with dignity, clarity, and independence. If this video opened your eyes, if it made you uncomfortable, if it made you angry or concerned for yourself or someone you love, don't ignore that feeling. Do something with it. Share this video with anyone who might be affected. Subscribe to this channel for evidence-based information that challenges outdated medical thinking. And most importantly, start the conversation with your doctor. Do not let another day pass with your brain at risk from preventable medication harm. Thank you for watching. Thank you for caring enough to learn. And thank you for being willing to advocate for yourself and the people you love. Take care of your brain. It's the only one you have. I'm Dr. Maria Lee, and I'll see you in the next video, where we'll continue uncovering the truths about medications and aging that too few people are talking about.